So these are red flag warnings, just like when there's fire weather, which we're getting into in the next couple of months, high winds, low humidity, all those things are risks that we all need to be on the lookout for. And so the most common red flag for patients to increase the risk of seizure or lower their seizure threshold is not getting enough sleep. So insomnia, a new baby at home or a puppy at home, or being worried about things, these are all things that can create disruption in sleep, and sleep is critical to help minimize the risk of seizures. The second most common reason why there may be a breakthrough seizure is missing medication. And so as I mentioned, some of these medicines might need to be given once a day or 3 times a day, but taking them on schedule, keeping that level constant is really critical. Illnesses, and specifically fevers, can increase the risk of seizure or lower the seizure threshold. Heavy alcohol use, not necessarily daily alcohol use, but heavy alcohol use, as well as certain recreational and prescription drugs. There are certain antidepressants, for example, that are associated with lowering the seizure threshold. And so again, this needs to be discussed with your doctor, as well as some poor dietary habits and hydration. And then when I was looking this up, it brought up psychological stress. And I think this is a really, really hard thing to understand from a biologic perspective. And it's really difficult for us to avoid completely. But in my career, I've certainly had a lot of patients say, well, I feel like the seizure came on because of stress. And so I don't quite understand the biology of that or how to mitigate that. But having that awareness, I think, is helpful. What you don't see on this list, which I think is also important, is tumor progression. So a seizure is not always associated with tumor growth. And everyone is worried about that being true when it happens, but these red flag warnings can create seizures even in an instance where the tumor is very stable. And so I think that that's important information also to keep in mind.